Welcome to our video on teratogenesis, or as I like to call it, embryology gone wrong. We're going to discuss teratogenic drugs first and some environmental exposures that can be teratogenic, and then finally we'll talk about some genetic things that can cause congenital malformations. In the last video, I mentioned that there is a period of development during which the baby is most susceptible to teratogens. Do you remember when that is? It's the embryonic period, which is weeks 3 to 8 of development. And why is this such a bad time for an embryo to be exposed to teratogens? What's going on during this time frame that's so crucial? Organogenesis. If you damage a developing organ or prevent it from developing normally, that's more likely to cause congenital defects. So let's start with some teratogenic drugs. Take a look at your study guide. This isn't meant to be a complete list by any stretch of the imagination, but it's a good start. The first one is ACE inhibitors and ARBs, which can cause renal failure and oligohydramnios. We use these drugs to protect the kidneys in diabetic patients, so it's easy to remember that they can cause renal damage in the fetus. There are 3 big classes of antibiotics that you should know about. Aminoglycosides, like gentamicin, can cause ototoxicity and cranial nerve 8 damage. Fluoroquinolones, like ciprofloxacin or levofloxacin, have a theoretical risk of causing cartilage damage in the fetus and also in kids based on animal studies. So we generally try to avoid quinolones in pregnancy, although there isn't good definitive data that they actually cause any problems in humans. And then the third group of antibiotics is the tetracyclines, like tetracycline and doxycycline, which can cause discolored teeth in kids. So in general, we don't give tetracyclines to children for that reason, and this could happen in utero as well. Another group of drugs that are potentially dangerous are cancer drugs. Cancer drugs obviously interfere with rapidly dividing cells, so that's a bad thing if you're an embryo that's trying to make organs. Cyclophosphamide and other alkylating agents can be particularly teratogenic. They can cause ear and facial anomalies, limb hypoplasia, and absence of digits. They're obviously going to interfere with rapidly growing cells. And then another cancer drug that's noteworthy for being teratogenic is methotrexate, which is a drug that works by interfering with folate metabolism, and that can lead to neural tube defects. We'll see that again in neuro when we talk more about the development of the CNS and neural tube defects like spina bifida. But the reason we give pregnant women prenatal vitamins that contain a large dose of folic acid is to prevent neural tube defects. So lock those 2 things together in your mind: neural tube defects and folic acid. And one of the approved uses of methotrexate is to terminate an ectopic pregnancy. So obviously you don't want to give that to a pregnant woman who's trying to stay pregnant. And you're probably inclined to say, gosh, if you're getting chemotherapy for cancer while you're pregnant, that's a pretty bad deal no matter what. Which is true, but I just want to point out that both of these drugs, cyclophosphamide and methotrexate, aren't just used for cancer. They're also used to treat inflammatory diseases like lupus and psoriasis and rheumatoid arthritis. So even though I've grouped these together as cancer drugs, that's not the only time you might see them used. The next few drugs in our list are seizure drugs. Both carbamazepine and valproic acid are known for causing neural tube defects, just like methotrexate. So if you have a patient with a history of seizures that's on one of these drugs, you want to make sure she's getting that folic acid supplement for at least a couple of months before she starts trying to get pregnant. And if possible, you want to get her off of the seizure drug, but sometimes you just can't. We used to recommend giving extra high doses of folic acid to these women, but that's never actually been proven to be beneficial. And then another seizure drug to mention is phenytoin, which can cause something called fetal hydantoin syndrome. That'll be covered in the neuro section when we talk even more about seizures and seizure drugs. Lithium is used as a mood stabilizer in patients with bipolar disorder, but it can cause a cardiac malformation called an Epstein anomaly. We'll talk about that in the cardiology section. Atorvastatin and other statin cholesterol drugs are basically contraindicated in pregnancy because they interfere with cholesterol synthesis, which is really important for making a lot of steroid hormones and other things a developing fetus needs. So there's a possible increased risk of CNS and lib abnormalities. Another medication you should know about is warfarin, which primarily can cause bone and cartilage problems, especially in the epiphyses. It can also cause nasal hypoplasia, which is kind of unusual. Which anticoagulant is considered safe during pregnancy? Heparin. Be sure you know that distinction. Isotretinoin is a retinoid, a vitamin A derivative. Vitamin A is retinoic acid, right? Isotretinoin is contraindicated in pregnancy because it causes lots of spontaneous abortions and a fair number of birth defects, like skull and CNS problems, heart defects, or parathyroid gland problems. There's a classic teratogen called diethylstilbestrol, or DES, that's so bad it was taken off the market. Children that are exposed to DES in utero are at high risk of developing vaginal clear cell adenocarcinoma later in life, often in their teens and 20s, but sometimes as early as 7 or 8. The other classic teratogen that nobody uses much anymore is thalidomide. Thalidomide was a sedative that was given to pregnant women 50 to 60 years ago until it was found to cause limb deformities called phocomelia, where you have severe hypoplasia of the arms and or legs. Thalidomide can be used to treat Hansen disease, also known as leprosy, but when was the last time you saw a patient with leprosy? And it's sometimes used to treat multiple myeloma, but that's usually a disease of older people well past childbearing age. Next, let's go over some other types of teratogens besides drugs. Some of these are kind of hard to avoid, but they're worth knowing for your test. Ionizing radiation, like X-rays and CT scans, can cause CNS malformations if the exposure occurs early in pregnancy, and an increased risk of cancer, especially leukemias, later in pregnancy. We generally try to avoid X-rays during pregnancy, but sometimes it's impossible. Excessive amounts of vitamin A can be teratogenic, just like we said with the vitamin A derivative, isotretinoin. It causes spontaneous abortions, microcephaly, and cardiac defects. Excess vitamin A can also interfere with the migration of neural crest cells, and it can interfere with homeobox gene or HOX gene expression. We'll talk about HOX genes and what they do in just a moment. Maternal diabetes can cause all sorts of problems like cardiac defects and neural tube defects. It can also cause something called caudal regression syndrome, where the sacrum fails to develop normally. Not gestational diabetes, because that happens way after the embryonic period and organogenesis. We're talking about women with pre-existing diabetes who then become pregnant. Along the same lines, maternal iodine deficiency can cause the baby to be born with congenital hypothyroidism, which we call cretinism. In this case, it's not the iodine that's teratogenic, it's the iodine deficiency that causes problems. Likewise, nicotine and cocaine aren't necessarily teratogens per se. They don't interfere with organogenesis, but they can lead to placental abruption, low birth weight, and intrauterine growth restriction because they interfere with the blood flow to the fetus. And there can also potentially be some neonatal addiction to these substances and withdrawal symptoms in the first few hours to days of life. But alcohol, on the other hand, is a major cause of birth defects. So let's talk about fetal alcohol syndrome for a moment. Excessive alcohol consumption, either binge drinking or lots of drinks on a daily basis, can be harmful. But we don't really know what a safe amount of alcohol would be to consume during pregnancy, so the Surgeon General recommends no alcohol at all during pregnancy. What do you see with fetal alcohol syndrome? There are some characteristic facial abnormalities with fetal alcohol syndrome, which include narrow eye openings with wide-set eyes, a smooth philtrum, and a thin upper lip. Alcohol can also cause cleft lip and cleft palate, so lots of midline facial abnormalities. Fetal alcohol syndrome can also cause intellectual disability, which used to be called mental retardation. And along with that, you can have microcephaly. You can also see something called holoprosencephaly. Holoprosencephaly is where the hemispheres of the brain fail to separate across the midline. And often it's associated with facial anomalies where the facial structures fail to separate, and you can get a single midline eye. So again, another kind of midline facial deformity. So those are all the teratogenic drugs and exposures we're going to cover. I know it's a lot of material, so let's go to the whiteboard and review these in a slightly different format. All right. I want you to take out a piece of paper and write down these 7 different anomalies that I've listed over here on the left, and then we're going to match them to the various teratogenic drugs I've listed on the right. Don't get lazy and just watch me do it. It's really helpful to go through the effort to write these down because it forces you to process this stuff using another part of your brain. Cartilage damage pairs with levofloxacin. Remember, fluoroquinolones hurt the bones. Discolored teeth pairs with tetracyclines. Epstein anomaly, the cardiac anomaly, where the tricuspid valve is displaced downward into the right ventricle so that the right ventricle is hypoplastic and the right atrium is abnormally large, is associated with use of lithium. Holoprosencephaly, where the brain hemispheres don't separate, can be associated with maternal ethanol use. Next is limb hypoplasia. Lots of things can do this, but we mentioned it with thalidomide and also cyclophosphamide. Spina bifida. Remember, spina bifida is a neural tube defect, and we said when you hear neural tube defect, think folate deficiency. But the drugs listed here that also cause neural tube defects are the 2 anti-epileptics, carbamazepine and valproic acid. And the last anomaly here is autotoxicity, which can be due to aminoglycosides, and gentamicin is the only aminoglycoside listed here. Be sure you can recognize these drugs as teratogens and know the problems that they are most likely to cause. And as a little treat for you today, I have a gold star. We're going to wrap up this video by talking about several genes that are crucial for normal embryogenesis and how mutations in these genes can lead to congenital anomalies. I just want to highlight a couple of the more testable ones. The first genes I want to mention are the homeobox genes or HOX genes. There's a short section on the HOX genes in your study guide. Homeobox genes are the blueprints for skeletal morphology. They code for transcription regulators, so these gene products regulate the expression and transcription of other genes. Basically, HOX genes make sure that the skeleton is laid out correctly, so you don't have arms and legs in the wrong places. There are some experimental models in which they've altered the HOX genes in fruit flies, and they end up growing legs on their heads where the antennae should be, or an extra set of wings, that sort of thing. In humans, mutation of the specific homeobox gene HOXD13 causes something called synpolydactyly. Poly is many or multiple, and dactyly has to do with the digits. So polydactyly is when you have more than the normal number of digits on a hand, like the 6-fingered man in The Princess Bride. But then syn means together, so syndactyly is where you have fusion of the fingers. So with this HOXD13 mutation, you have synpolydactyly. So there are extra digits and they are fused together. As we've already mentioned, excess vitamin A, or retinoic acid as a derivative of vitamin A, can alter HOX gene expression. So again, we don't give vitamin A supplements to pregnant women. The next gene to discuss is the sonic hedgehog gene. This family of genes was first discovered in fruit flies, and for whatever reason, they were named hedgehog genes. Then somebody got cute and named one of the genes Sonic Hedgehog, like the video game character. There's also a cancer-causing gene that they named Pokemon until Nintendo threatened to sue. True story. But this Sonic Hedgehog gene is expressed at the buds of the limbs in a zone called the ZPA, or the zone of polarizing activity. And kind of like the HOX genes, the Sonic Hedgehog gene is involved in organizing the layout of the embryo in an anterior to posterior direction, setting up which pole is going to become the head and which pole is going to be the tail. and then organizing all the points in between. One thing you need to know is that mutations of sonic hedgehog can cause holoprosencephaly, where the hemispheres of the brain fail to separate across the midline, and in severe cases, you have that single midline eye. Where did we see that earlier? That's right. Fetal alcohol syndrome will also cause this. So sonic hedgehog is important for organizing the embryo along the anterior-posterior axis in the craniocaudal direction. And there's another gene called WNT7, which is important for organizing the embryo along the dorsal ventral axis so that your feet and your nose are pointing in the same direction. One student suggested that the NT in WNT7 could remind you that this gene controls the direction of the nose and toes. And there's a gene called FGF that is important for limb lengthening. FGF stands for fibroblast growth factor. So if you have a defect of the FGF gene, you're going to have short limbs. And actually, a mutation in the gene for the FGF receptor causes achondroplasia, which results in, you guessed it, short limbs. All right, that's it for our video on teratogens. Go ahead and pause the video and answer the end of session quiz questions on your own, and then we'll go through the answers together. Let's go over the answers to the end of session quiz. First question, which antibiotics are potentially teratogenic? Aminoglycosides, tetracyclines, which cause discolored teeth, and fluoroquinolones, which can potentially cause cartilage abnormalities. Next question. A pregnant woman is diagnosed with a deep venous thrombosis of the left leg. Which anticoagulant is contraindicated during pregnancy? That's warfarin. And which anticoagulant is preferred? That's heparin. And the last question. Examination of a fetus from a spontaneous abortion at 14 weeks gestation reveals a vestigial pair of legs that arise from the torso just below the arms. A mutation in what family of genes is the most likely cause of this malformation? This is the homeobox genes, Hox genes. Remember, Hox genes determine the layout of the appendages. That's the end of session quiz. But just below, you'll see this table called Rapid Fire Facts. We have identified almost 300 of the highest yield factoids and high yield associations, most common causes, buzzwords basically. A lot of people will tell you that step 1 doesn't test buzzwords, but honestly, if you know the buzzwords, it will save you some time in coming to the right diagnosis quickly, so that then you can answer whatever the question is asking about the pathophysiology or whatever. So in some of our videos, after the end of session quiz, we'll have a handful of these rapid fire facts for you to jot down. Then later, you can flip through these and cover up one side and quiz yourself, or get a study partner and take turns quizzing each other. These are great to go through at the end of the course, maybe on the last day before your exam. So let's go through these rapid fire facts. The most common cause of neural tube defects is folate deficiency. The most common preventable cause of congenital malformation in the U.S. is alcohol use during pregnancy. All right, that's it for this video. I'll see you next time.